the chronicity of your disease and your inheritance of your genetic background and all of that, the food and the diet and all these things these people are talking about have an influence on how many stem cells you have. So oxygen, however, some people are going to respond in needing more hyperbarics because their stem cell levels are much lower just because of their lifestyle. So, let's see, I want to back that up. Inflammasomes is the new buzzword, and we know that inflammasomes are the low-grade burning. The acute inflammation everyone knows about, but what we're finding in science is stuff called inflammasomes. They're low-grade, and so they're activated by infection, of course, but stress that Dr. Sears was talking about the other day can cause an activation of these low-grade inflammatories. It results in whatever you've inherited, it's a trigger for it. It can give you acquired inflammatory disease. Tumor necrosing factor is a cytokine that has been known to kill cancer cells when you give it in high doses. The interesting thing that's in science now is they realize when this is at a low level, it actually promotes tumor growth. So there's a lot of research going into what this all means. Sterile inflammasomes would be, like gout. That's not an infection, but that's where we get these low-grade inflammations that break out into a painful toe. Chronic stages can happen like fibrosis in your liver from the abuse of alcohol. Non-sterile would be infections or wounds. And the interesting things about inflammasomes, they are finding that for science, the same inflammasome is related to Alzheimer's, gout, and heart disease. And so they're trying to look now and say, well, gee, some of the heart medications that we've got might be good for Alzheimer's. Oh, what about gout? So this is opening up new horizons in research because they're finding these inflammasomes. There's numbers of them, and now one of the things that we talked about is what about eating? Well, they found out that eating can trigger an inflammatory response. And if you eat too much in one meal, your liver is really having a hard time processing all of that, and we can get liver disease. So isn't it interesting that fasting and exercise turn off the genes triggering inflammasome? Exercise that Dr. Sears was talking about. Well, exercise causes you to what? Increase the heart rate, which increases blood flow, which increases oxygen into the tissue site. Why does the doctor tell you to have exercise? Because you're oxygenating yourself. How does low-grade inflammasomes stay active? Well, if you're doing something chronically, you have bad diet and eating a lot of sugar, these cells actually become tolerant to it. They don't fight these things as often. And ATP, which we know is in the mitochondria is the gas or the fuel of our body, it can break down and delays breakdown. So the NOD-like receptor P3 is an area of heavy research, and so that's backed up in my references. So hyperbaric oxygen destroys these low-grade inflammatory infections. So it's that hypoxia is necessary for these inflammasomes to be around. So one of the uses of hyperbarics that I'm happy to let you understand that a lot of the inflammatory things that we're concerned about, oxygen under pressure acts as a drug, and it has these wonderful effects on our body and can extend our life and help us fight some of these inflammatory things. It's been a pleasure to be here. If there's any questions, if we have time, I'd be glad to take them.
Some of the symptoms you described with the veterans seem to be common with some of the symptoms that we see in bipolar. Any application of hyperbaric to that condition? I couldn't cover everything like so many of the speakers here today. We work with drug and alcohol. We work with psychiatric cases. A number of bipolar people someone when they were 6 years old fell out of a tree and hit their head, and then they're diagnosed bipolar. And when we look on the SPECT imaging, there are differences in brain SPECT imaging on legitimate bipolar, because there are some, but it's amazing how many bipolar psychiatric patients are head trauma people. I hope that answers your question.
With the hyperbaric chamber, does it work the same way as an altitude chamber? Have you ever checked into that? Well,
the science in hyperbarics, a lot of it came from the military, the pilots that are way up in a hypoxic environment flying, thousands and thousands of feet up. So an altitude chamber, the thing about the key to oxygen under Boyle's law, the higher the pressure that you have. Boyle took a container and put water on the bottom, and then could fill it with any gas you can think of. And if you put that gas under pressure, you push more of it into the water. So when you do that to a human, the water of the blood is the plasma. So the higher the pressure you use, the more oxygen you push into your plasma. And by increasing the pressure of the oxygen, we can increase in wounds. This is why we treat radiation necrosis. It's the only treatment for it when you get burned by an X-ray. It's the only way to stop that. So we saw a lady yesterday talking about radiation necrosis and how stem cells help. You add the hyperbarics to it, and it's been known now for centuries that that's the treatment for radiation necrosis. There's 13 different medical indications for hyperbarics, and that's one. So pressure and environment. Just pressure alone without oxygen causes cells to change, and that can be in cardiac muscle. 0.001 atmospheric change will create a change in heart muscle cell activity.
Thank you, Dr. Cralle.